Now, facial implants are very important if you're going to provide high-quality facial aesthetic care for your patient. It's really no way to do some of the things that implants do without having them available. You just can't provide the end result that you're hoping to get if you don't know when to use them and how to use implants well. We talk about the reverse triangle or inverse triangle of beauty, and what we mean by that is if you look at younger patients, they have a very healthy cheek mound and their face goes down into a nice V in this direction, so you have this inverse triangle. As we age, the triangle goes the other direction. This becomes full and this becomes shallow, and that's one of the signs of aging that we try to counteract with either surgery and or implants depending on the patient. Now, when would you use an implant versus doing surgery? And that's key to doing this type of surgery well, and that's one of the reasons I strictly do facial aesthetics and don't wander in other areas. Strictly staying in the face allows you to be a little better at this, I think. Patients that have inadequate malar strength are a candidate for an augmentation of that area. And the malar is the cheekbone that in some patients, even when they're younger, is deficient and needs to be improved. In older patients, as they get past the 5th decade, they tend to lose bone in this area. There's demineralization and loss of 3D volume of the bone, but we also lose fat in and around the cheekbone and underneath, what we call submalar atrophy. So in those patients, augmentation of the cheekbone and the area underneath the cheekbone is very helpful. On other patients that we see, it's their chin that is weak and a problem, and frequently in rhinoplasty patients and in facelift patients, we're also looking at the chin to see if it needs to be supported. Certainly you don't want to overdo it. That's not the idea. A well-done chin implant, nobody's going to know it's there besides the patient and the doctor. It blends in and looks like it should have been there all along. I've never had to remove a chin implant in 20 years of practice. So they're very well accepted, and patients, when they get them, like them. The goal of doing a chin implant is to provide, when you're doing a facelift patient, is to provide the support for the neck structures, the muscles all attached to the chin, and it's kind of like the tent. If you have the tent pole holding the tent up and it's nice and tight, if you take half that pole down or a third of that pole down, everything starts to get loose. And the same thing's true about the chin. If you don't have that support, if you do surgery to improve this area, it's not going to last, it's not going to look as good. So that's why we frequently suggest a chin implant in facelift patients. For noses, if you have a weak chin, it makes the nose look bigger. And there have been patients over the past 20 years that I've seen that have come in thinking they need their nose done, but all they needed was a chin implant and their face looked really good. So knowing when to use those approaches is extremely important to providing high-quality aesthetic services in the face for your patients. The way a cheek implant is done is we make a small incision inside the mouth where it's not visible, and we use instruments to provide or open up a pocket on top of the bone that fits the implant. Now, for a younger patient that just has deficient cheekbone, doesn't have enough of a cheekbone to give that nice, beautiful inverted triangle look, we're doing an augmentation of the malar bone only, and that implant looks something like this, and it fits right over the cheekbone, right over this part of the face called the zygomatic arch. It's a very routine procedure in my practice. These implants don't bother the patient. They're very easily inserted, and indeed easy to remove if the patient finds that they don't like it, although that's never happened in 20 years. This implant is for patients that are not only losing support of the malar eminence or the cheekbone, but also are losing soft tissue underneath called submalar atrophy. You can see it's a little bit larger, and this implant sits in the same position, but it helps to fill in the tissue, soft tissue atrophy underneath the cheekbone. So frequently we're using this size implant or sort of implant to help our older patients who are presenting with the loss of that inverted triangle to help restore youth and their natural good looks. Now, for chin implants typically look something like this, although there are some variations to the theme, and they're put in with making a little incision underneath the chin, and again making a precise pocket on top of the bone called a subperiosteal pocket, and then the implant fits in that pocket like a foot fitting in a well fitted shoe, and augments gently the whole anterior part of the mandible, as you can see. When this implant is put in and fitted, and after the patient is healed, if you feel that area in the patient, you can't even feel where the implant starts and the jaw ends. It just is a smooth contour. And like I said, the idea of a chin implant is not the same as a breast implant. You're not putting this in to make a statement or for people to go, boy, look at that chin. The idea of putting a chin implant is to make it look natural, look like it should have been there all along.